McLaughlin, can you hear? I think we did that.
Sorry, it's I'm gonna work on this in 1 second. Okay, this one. Do you remember
Last time we had it went.
I'm getting feedback.
We have to meet the computer.
Okay. No, cool. Sorry, we don't do this.
You're not playing on the phone.
All right, we're going to call this Henry County Board of Health meeting to order. Board members present: Karen Blessinger, Joshua Underhill, Creed Cook, and myself. Dr. McLaughlin is on the phone as well, and then we've got Dr. Miller here. Steve is on as well. Okay. And then it looks like we're missing Jerry Cash today. All right, so Angela previously sent out the minutes from the May 20th meeting and the July 1st meeting to the board. So I'm going to, if everyone's had a chance to take a look at those, then we'll need a motion to approve those.
I make a motion to approve the May 20th and July 1st minutes from the meeting.
And a second? All approved, say aye.
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 All opposed? All right. Looks like the next thing that we're going to get into is the environmental department report.
I don't have anything earth-shattering to report right now. We're still kind of at a standstill with the Clearview Day. Hoping that maybe something can get. Oh, yeah. Push the button, I assume. the standing sewage issues. Really hopeful that one day maybe the city, county can come together on some sort of agreement for sewers. Our department has been chasing our tail out in that area since documented in the 70s or 80s, and we still continue to do so. We are treating the area for where there's standing water for mosquitoes, and then dye testing as complaints come in, but it just seems to be a constant battle out there. So that's all I got right now.
Thanks, Shaylee. Next on the agenda, the registrar update. It looks like the next thing we have is a COVID-19 testing and vaccination update.
Vaccinations have really ramped up the last week. People are responding to the increase in numbers throughout Henry County and the rest of Indiana, and the Delta variant concern. We are already getting calls and making appointments for some of the boosters for our individuals who have solid organ transplants and are on active chemotherapy and different things. The federal government released that September 20th, we then can start giving boosters to anyone. So we're already getting phone calls about that. We continue to provide all 3 vaccines in the office. There's been a little bit of a delay just because I think that demand has increased, but we were finally able to get our Pfizer back in today and get some Johnson. And Johnson honestly has picked up quite a bit. As far as testing is concerned, we have blown the roof off of the testing barn this week. I was telling Dr. Miller that just earlier this afternoon I had to ask Doug to drive to Kokomo to pick up 500 kits because we ordered 200, got them in on Tuesday, and then by about noon today we were down to 12. So I couldn't get them from Langham. I have 1,000 more coming in tomorrow. We have almost utilized our stock of the health department stock of the Buy Next Now cards because we offered testing to the Shenandoah School Corporation students, staff, and their families on Monday and Wednesday of this week. That was very well received. We did 603 people in those 2 days. And we have the State Department of Health strike team coming out tomorrow. It's their mobile unit, so they'll be at the Shenandoah Elementary tomorrow from noon until 8 p.m. both days, Friday and Saturday. We've published everything out so people can register ahead of time, hopefully to save time, but they don't have to. They can just come and we'll get them registered. It should be going out to the papers, and it went out on our Facebook page, and it's also going out through Nash WMDH radio for everyone. And that's for everybody in the county. It's not just for the situation at Shenandoah right now. Our numbers are going up. That's just the bottom line. In the first 18 days of August, we've had the highest number of children 18 and younger test positive than we had all of last year. So we were up to a number of tests that we did was a little over 350. So I think that put us at 26% of those positive tests were children, and many of them are younger, under 9 years old. We've had a couple of reports just anecdotally from community members that we've had an infant and a toddler hospitalized. I don't have specifics about that, but I just want to make everyone aware of that. And I do know that in our meetings this week with the State Department of Health, they really impressed upon us that the numbers for children are going up all across Indiana. And they even mentioned that we have some pregnant moms who are on ECMO right now. And so we don't know what their lung capacity is going to be. And, it's bad enough you've got one individual in the ICU, but you've got an unborn baby now with mom on the vent, not knowing if they're going to need a lung transplant at some point. So everybody's concern is quite heightened. If I may, I'll just go ahead and tell you then about the nursing department. While I'm here, we are also picking up on childhood vaccinations, which is fabulous. So the grant that we got to hire that part-time nurse, it's working very, very well. And then the last thing I have as far as the administrator's report, I apologize, I don't have a financial report for you. Things got sideways this week, and I had two choices, so we tested people. But otherwise, everything's still fine. Grants are still doing very well, and we're working on that. They're slowing down on getting those reimbursed, so I'm making the auditor's office just a little bit nervous, but we keep in touch with the state, and we've got a couple of invoices, big ones out, waiting on that. Does anybody have any questions for me?
So you were able to find someone part-time to help you out from that grant that we talked about?
Yes, we hired Shay Bex, who is our COVID program, COVID vaccine coordinator. And so it's a 28-hour a week, so she's part-time. And she's done a fabulous job. Her degree is in public health, and she's great putting things on Facebook. She's very tech savvy. She's coordinating all of our contract staff to when we have, Boar's Head or whoever, Draper, say, hey, can you come do shots? Then she orchestrates that whole thing. And she pretty much stopped what she was doing this week and went out and did testing with us. And that's all I got. Okay.
All right. It looks like under new business, there is a letter of support for local school corporations to fully follow the recommended CDC back-to-school guidelines. So is that a letter that needs developed, or is that a letter that needs looked at and approved?
I have not developed the letter. Dr. Miller and I have had quite a bit of conversation in the last week with the superintendent, and we have the same type of stress and strain on the school boards. And so in talking with them, I just felt like it would go a long way if we would weigh in. Even this set and go Act 5 took us out of the mix because we can mandate masks in schools as the county health official, but we would have to take that to the commissioner, and the commissioner would have to approve that. As it stands, the school boards currently are weighing the situation in their schools. All five of them have done a fabulous job all last year of working together and trying to present a united front so that all Henry County children we kind of does and they're really struggling right now because of the, the superintendent of the school board and the school board are correct. They're getting it from both sides. And unfortunately, what our office felt like for the last year and a half. And so I just want to give them some type of information or support from the health board that said, we recognize these schools. I passed out a letter from UNICEF and having the pediatrics, the fourth letter with
Yeah. So, there was a letter that was a combined letter from the Indiana Academy of Family Physicians and Indiana Academy of Pediatrics. Like I said, it was a joint letter encouraging to follow the CDC guidelines and have mask wearing with all children within the school buildings.
we do have a meeting set up with the five superintendents and the chairs of their school boards and their school nurses on Monday. And I would like to be able to just, a simple letter that signed from you all that says that we either support or we don't support, if that would be the case, following the CDC guidelines. And one of the benefits
So have they, I would assume from what we've done over the past year and a half that they've followed CDC guidelines up to this point, correct? For the most part, the schools have, from what I've seen?
I haven't been in the school building. I have been told that, the forward-facing CDC is not being as diligently done as it was last year. And that I think is the trick, is that, but it only works if everybody in the classroom is active. So you have to be facing forward, 3 feet apart, everybody has to have their mask on. Then the CDC guidance allows us to contact trace out to the CDC, which will save some kids from having to do contact tracing out.
And reminder that, middle school and high school students who have already been vaccinated do not need to be quarantined.
The guidelines we recommend that for if they are a contact trace and they are fully vaccinated, that they wear the mask for 14 days. Just because we know from the Massachusetts study that the Delta variant can colonize and still spread it even though we don't know. But it's still could be out.
So moving forward, if this is coming on Monday, you would develop that letter, I would assume, tomorrow.
Correct. Or it can just be a couple of statements that probably want to just make that statement tonight and then I can certainly, we'll have it in the minutes and it'll be voted on and I can pass that along.
All right. Does anyone motion, I believe the CDC guidelines, if we stated it that we recommend they follow the CDC back to school guidelines, I don't know if that's okay with, I mean, it seems pretty vague, but it allows them to follow the continuing changes that the CDC has and has had over the past year and a half. Because if, like we've learned, if you get too detailed, you're just digging yourself a hole. So, I mean, if we did and we just said we recommend as a board that you follow these guidelines, then it would be put out there at least. So.
I like the analogy that I heard where, people are questioning why does CDC why are they changing their guidelines? Well, someone says, it's like the weather and the traffic. It's a moving target. You don't plan a party 2 weeks from now because of today's weather. So, and that's the thing, is our knowledge. And nobody anticipated this variant would overrun the country as it has.
All right, well, I'm going to ask if anyone wants to make a motion to approve the letter of support, just to give the school corporation some public health board backing of our support in following the recommended CDC guidelines.
I think I'll move. This is Josh Underhill. I'll move to support that.
Second? Do we have a second? Steve Warner with the second. All approve, say aye.
My name, based upon the ordinance that was passed, the governor allowed us to have Zoom meetings. Roll call vote.
All right, Steve Warner.
Steve, can you hear? Okay, are you voting yes or no on this? You have to unmute and actually say yes.
Dr. McLaughlin? Karen?
Yes.
Cree?
Yes.
Josh?
Yes, aye.
All right. All opposed, say nay. Oh, Brooke Cowan, yes. All right, if you wouldn't mind though, as you send that to them, or prior to sending that, maybe shoot it to us, just so we'll be able to see what a copy of the letter that's going out to the schools. Yep. Okay. Do we have anything else that we need to talk about this evening?
Open it up, or?
Does anyone have anything that needs to come to the board this evening?
Nan Polk. I just wanted a clarification because I didn't hear Angela that well. No, that's fine. It's the way we are today. Did you say that there had been more students that had the COVID so far this year in the first 2 weeks of August than all of last year?
So she said from August 1st to August 18th, in those 18 days of testing, there's been more positive cases than since January 1.
Since January 1. Okay. That, I wanted to make sure I heard that correctly. Thank you.
Yes, just to clarify, that's children, not necessarily students. So that can be preschool age as well.
Hello, I'm Pat. Hi, I'm Pat Cronk, and I apologize. I just got off work, so now I'm here, and I don't know where you're at in this meeting, but I came as a concerned citizen and as a registered nurse to express my concerns at the appropriate time. I don't know if the appropriate time has come and gone, or
No, you're absolutely fine.
okay, is now the time appropriate for me to?
Now's the time. Go
Okay.
right ahead.
Well, I just care about the issue. At Ball, just today, they have pediatric patients who are COVID patients, inpatients. We are getting deluged. I saw about approximately 20 patients that were mine I do case management now. And of those 20, about a quarter of those 20 were from other hospitals they're full. And I just don't see how we can keep on blindly accepting what isn't scientifically proven to be safe, or what is proved to be unsafe. How we can accept that, how we can't take every action possible to protect people and children and teachers in the school system. And furthermore, I would say that I would advocate for our public officials to realize that in county and city government, that hopefully demands a level of expertise. But the Board of Health has a level of expertise that county and city governments don't necessarily have. And so it seems to me that if I needed a doctor, I wouldn't go to the car mechanic, even though he's got an expertise in that area. And if your car doesn't work, you wouldn't take it to the guy that does a wonderful job painting. You would go to the people who are experts. So I would think that we would defer to the experts in this case. So I want to just show that I'm not the only one that feels that way, but I am one person that was able to come tonight, so I'm strongly advocating for that and respect the work being done. Thank you.
Thank you. And thank you for everything you do in healthcare. Good evening.
The number one cause is human behavior. The number one cause is human behavior. Not distancing, not wearing masks, not getting vaccinated, being selfish, and not concerned for other people's health and safety.
Thank you, sir. So the reminder for HCH, they are now giving their vaccines at the Northfield Park, by the new Y at the immediate care facility, coronavirus.in.gov. You can sign up for the vaccines. Is 211 still it's still operational? And some of the pharmacies, you sign up individually with them. Because is CVS still sign up? Because I think CVS has its own website to sign up.
If I wanted to get a vaccine, COVID vaccine at Walgreens, do I go to the state website, Outshot, or do I go to the Walgreens website? There you go.
Anything else? before we motion to adjourn? Well, we appreciate your thoughts, and we appreciate you being here, and we appreciate your support. Know that we are doing our due diligence on our part to do what we can. So with that being said, does anyone make a motion to adjourn?
I'll motion to adjourn.
Second?
No second needed. Adjournment, no second.
All right. We are adjourned.